So EMDR is an acronym. It stands for eye movement desensitization and reprocessing. It was developed in the late 1980s by Francine Shapiro, and it was an evidence, or it is an evidence-based treatment modality that was developed for PTSD in particular. So anyone with a form of trauma, that's what this modality is for. The idea of EMDR is that there are unprocessed, stuck memories in our brain. EMDR is meant to help clear those memories and process them so that you can heal from your trauma and not feel trapped by your trauma. Like the name describes, it does involve eye movements. So oftentimes there's eye movements going back and forth, left or right, or following a light or something on your screen so that your eyes are moving left and right. The idea of that is you're connecting both the left side of the brain and the right side of the brain in order to process those memories that are stuck in your brain. In EMDR therapy, there's different ways that the practitioner can facilitate the session. So maybe the most common one is the eye movement, hence that's in the name of EMDR as well. There's also bilateral stimulation that you can do through tapping left and right, even through sound left and right through your ears. So the idea is that you are going between left and right sides of your brain to help with that reprocessing. So depending on your comfort level, the therapist will guide you in what type of bilateral stimulation that you want to use in session. To start the session, or this may take a few sessions, the therapist will do some history taking. The therapist will assess what your support system is. Sometimes the therapist will go through a whole trauma timeline and assess what memories that you want to focus on for session. And unlike maybe some other types of therapy, EMDR is very targeted. There is a very specific, almost formula, if you will, that helps you move through the process. So sometimes this takes only a few sessions to clear a memory. Other times it can be longer if there's more complex trauma or more severe trauma. So the goal, though, is that you will not have to be in EMDR therapy your whole life, that you work on that specific issue, you feel better, and you're able to kind of move on and maybe do some other types of therapies if you want.